Back pain after 50 is not simply a mechanical problem of bones and muscles wearing down. It is a deeply human experience, shaped by biology, memory, emotion, and adaptation. A quiet signal from the body that something within its intricate system is asking for attention and understanding. It often begins so subtly that many dismiss it as an unavoidable part of aging. A small stiffness in the morning, a slight hesitation when standing, a gentle ache after a long day. But beneath these mild sensations lies a complex dialogue between the nervous system, the connective tissues, and the brain. The body, in its wisdom, is constantly scanning for safety, and when movement patterns become inefficient or tissues become sensitive, it sends pain as a protective message, not to punish, but to preserve. Over time, however, this protective response can become exaggerated, turning into chronic discomfort that limits confidence, freedom, and joy in movement. As we age, the structures of the spine naturally undergo transformation. The discs that once held abundant water content gradually lose hydration, reducing their shock-absorbing ability. Ligaments become slightly less elastic, and muscles may lose tone if not regularly engaged. Yet these changes do not automatically mean pain. In fact, many individuals with visible spinal degeneration experience no discomfort at all, which reveals a profound truth. Pain is not solely determined by physical changes, but by how the nervous system interprets and responds to those changes. When movement becomes limited, the brain begins to associate certain positions or actions with threat, tightening muscles and heightening sensitivity. This creates a feedback loop in which fear of pain generates tension, and tension generates more pain. Breaking this loop requires not force, but gentle re-education of the nervous system through safe, controlled movement. Slow spinal mobility exercises play a critical role in this process. The spine is guided through its natural curves in a calm, mindful way. Sensory receptors within the joints and muscles send new information to the brain. This input helps recalibrate the nervous system's perception of safety, teaching it that movement does not equal danger. With each gentle repetition, neural pathways associated with fear and guarding begin to soften, replaced by pathways of trust and confidence. Blood flow increases, delivering oxygen and nutrients to tissues that may have been deprived, while metabolic waste products are carried away. The result is not only physical relief, but a subtle emotional shift as the body relearns ease instead of bracing. This process is not about stretching aggressively or pushing beyond comfort. It is about rediscovering fluidity, allowing the spine to remember its innate capacity for graceful motion. The human spine evolved to be dynamic, capable of bending, rotating, and extending in harmonious coordination. When these movements are neglected, stiffness develops, and stiffness breeds vulnerability. Gentle mobility restores resilience, not by forcing change, but by inviting it. Each small movement becomes a message of reassurance to the nervous system, reminding it that the body is capable, adaptable, and safe. Over time, this reduces baseline muscle tension, which in turn decreases compressive forces on the vertebrae and discs, easing the mechanical stress that often contributes to pain. There is also a profound psychological dimension to this process. Chronic pain can subtly reshape identity, causing individuals to see themselves as fragile or limited. This belief influences posture, breathing, and movement choices, reinforcing the very patterns that sustain discomfort. Gentle spinal movements, practiced with awareness, offer a way to rebuild self-trust. As mobility improves, confidence grows, and the fear of movement gradually dissolves. The mind begins to reinterpret bodily sensations, not as warnings, but as neutral signals of effort and engagement. This cognitive shift has measurable physiological effects, reducing stress hormones and promoting parasympathetic nervous system activity, which supports healing and restoration. From a scientific perspective, this interplay between movement and perception highlights the remarkable plasticity of the nervous system. Neural circuits are not fixed. They adapt continuously in response to experience. When we move in new, gentle ways, we create fresh sensory input that reshapes these circuits, diminishing hypersensitivity and improving motor control. This is why consistency matters more than intensity. Small daily movements accumulate, gradually altering the internal landscape of the nervous system. Over weeks and months, what once felt painful becomes neutral, and what once felt difficult becomes effortless. Perhaps most importantly, this approach fosters a relationship of compassion toward the body. Instead of battling pain, we learn to listen to it, to interpret its signals with curiosity rather than fear. This shift transforms movement into a form of dialogue, where each motion is a question and each sensation an answer. In this dialogue, the body reveals its needs, and we respond with patience and respect. Through this exchange, healing unfolds naturally, not as a dramatic breakthrough, but as a steady return to comfort, confidence, and ease, allowing movement to become once again a source of freedom rather than limitation. At the center of lasting relief from back pain lies a hidden system of support, one that works quietly beneath the surface of conscious movement, shaping stability, balance, and ease with every breath and step. This system is the deep core, a network of muscles that includes the diaphragm, the pelvic floor, and the deep abdominal layers that wrap gently around the spine like a natural corset. In youth, these muscles activate effortlessly, coordinating with each other to stabilize the trunk before any visible motion occurs. Over time, however, especially after 50, this reflexive coordination can fade, weakened by prolonged sitting, reduced activity, and habitual shallow breathing. The result is a subtle but significant loss of internal support, leaving the spine vulnerable to strain and the larger surface muscles forced into constant overwork. When these deeper stabilizers become less responsive, the body compensates by tightening the more superficial muscles of the back, hips, and shoulders. This compensation creates a state of chronic tension where muscles remain partially contracted even at rest. Such tension restricts circulation, reduces oxygen delivery, and limits the removal of metabolic waste, all of which contribute to persistent discomfort and fatigue. At the same time, the nervous system interprets this constant tension as a sign of threat, heightening pain, sensitivity, and reinforcing protective patterns. The individual may feel rigid, guarded, and perpetually tired, as though carrying an invisible weight that cannot be set down. Reawakening the deep core begins not with forceful exercise, but with breath. Breathing is the most fundamental movement of life, yet it is often overlooked as a therapeutic tool. The diaphragm, the primary muscle of respiration, is also a key stabilizer of the spine. When breathing is slow, deep, and rhythmic, the diaphragm descends fully, gently increasing pressure within the abdominal cavity. This pressure creates a natural brace around the spine, enhancing stability without rigidity. At the same time, the pelvic floor and deep abdominal muscles respond reflexively, forming a coordinated system that supports the trunk from within. This internal support reduces the load on the lower back, allowing it to relax and move more freely. However, modern stress and sedentary habits encourage shallow, chest-based breathing, which bypasses the diaphragm and diminishes this stabilizing effect. Over time, the body forgets how to breathe in a way that supports movement, and the spine loses its internal scaffold. Restoring diaphragmatic breathing reintroduces this lost foundation. With each slow inhale and controlled exhale, neural pathways are reactivated, teaching the brain how to coordinate these deep muscles once again. This process is subtle, yet profoundly powerful, as it reshapes the way the body organizes itself during both stillness and motion. Breath-based core movements further enhance this re-education. Gentle exercises that synchronize slow breathing with small, controlled motions of the limbs challenge the body to maintain internal stability while moving. This trains the nervous system to anticipate and prepare for movement, engaging the deep core before external forces act on the spine. Over time, this anticipatory control becomes automatic, reducing the risk of sudden strain and improving overall balance. The body begins to feel lighter, more coordinated, and less burdened by tension, as though an internal architecture of support has been quietly restored. Beyond mechanical stability, this approach exerts a calming influence on the nervous system. Slow, rhythmic breathing stimulates the vagus nerve, a central pathway of the parasympathetic nervous system, which governs rest, digestion, and recovery. Activation of this pathway lowers heart rate, reduces blood pressure, and decreases levels of stress hormones. As the nervous system shifts into a state of calm, muscle tone softens, pain sensitivity decreases, and healing processes are enhanced. In this way, breath becomes both a physical and emotional anchor, grounding the individual in a state of safety and ease. There's also a profound psychological dimension to reconnecting with the breath and deep core. Many people carry unspoken stress, grief, and anxiety within their bodies, often manifesting as tightness in the abdomen and chest. Gentle breathing practices invite these areas to soften, creating space for emotional release. This release is not dramatic, but gradual, unfolding as a sense of lightness and clarity. With each mindful breath, attention shifts inward, fostering a deeper awareness of the body's rhythms and needs. This awareness cultivates self-compassion, encouraging individuals to move with patience rather than urgency, and to listen rather than demand. As this internal support system awakens, everyday activities begin to feel different. Standing from a chair, lifting groceries, or walking across a room no longer strain the back, but flow with greater ease. The spine is no longer a vulnerable column requiring constant protection, but a dynamic structure supported from within. Confidence grows, not from the absence of pain alone, but from the knowledge that the body possesses an innate capacity for stability and resilience. Through consistent, mindful practice, the deep core becomes a source of quiet strength, allowing movement to feel safe, fluid, and natural once again. The relationship between the hips and the lower back is one of profound interdependence, a silent partnership that shapes every step, bend, and turn of the human body. When this relationship is balanced, movement feels fluid and effortless, but when it becomes strained, discomfort emerges not as a sudden event, but as a gradual accumulation of stress. After 50, this partnership often becomes disrupted, not because the body is failing, but because modern habits encourage stillness more than motion. Long hours of sitting shorten and tighten the muscles around the hips, limiting their natural range of movement. As the hips lose mobility, the lower back is compelled to compensate, absorbing forces it was never meant to bear alone. And over time, this redistribution of load becomes a primary contributor to chronic back pain. The hips are designed as powerful, mobile joints capable of large arcs of motion in multiple directions. They are meant to generate force, absorb impact, and guide the body through space. When their movement becomes restricted, the spine steps in, attempting to provide the flexibility and power that the hips no longer offer. This compensation places excessive strain on the lumbar vertebrae, discs, and surrounding soft tissues. With each step, bend, or twist, small mechanical stresses accumulate, gradually sensitizing the nervous system and reinforcing protective muscle guarding. What begins as mild discomfort can slowly evolve into persistent pain, shaping posture, altering gait, and diminishing confidence in movement. Gentle hip-opening movements offer a pathway back to balance. These movements are not about forcing flexibility, but about restoring communication between the brain and the joint. Within the hip capsule lie countless sensory receptors that inform the nervous system about position, tension, and movement. When these receptors are understimulated due to inactivity, the brain loses accurate feedback, leading to poor coordination and increased risk of strain. Slow, mindful hip movements reawaken these receptors, enhancing proprioception and improving the body's ability to distribute forces efficiently. As awareness of hip position and motion improves, the spine is freed from unnecessary compensatory work, allowing it to relax and function within its natural limits. From a physiological perspective, increased hip mobility improves circulation throughout the pelvic region and lower limbs. Enhanced blood flow delivers oxygen and nutrients to muscles and connective tissues,
also meters supporting
repair and reducing inflammation. At the same time, improved venous return and lymphatic drainage assist in the removal of metabolic waste products that contribute to soreness and stiffness. This internal cleansing process creates a more favorable environment for tissue healing, gradually softening areas of chronic tightness and restoring elasticity. Over time, movements that once provoked discomfort begin to feel smoother, lighter, and more controlled. There is also a significant neurological component to this transformation. Chronic pain often involves heightened sensitivity within the central nervous system, where the brain amplifies signals from the body as a protective measure. Gentle hip movements provide non-threatening sensory input that helps recalibrate this heightened response. With repetition, the nervous system learns to interpret these sensations as safe, reducing its tendency to overreact. This process, known as desensitization, gradually lowers pain thresholds and restores a more accurate perception of bodily signals. As fear of movement diminishes, muscle guarding relaxes, further easing mechanical stress on the lower back. Emotion and memory are woven into this experience as well. The hips and pelvis are regions where many people hold tension related to stress, unresolved emotions, and habitual patterns of bracing. Gentle, sustained movements in this area can evoke a sense of release, both physical and emotional. This release is subtle, unfolding as a feeling of spaciousness and ease, rather than dramatic catharsis. With each session, the body learns that it is safe to let go, to soften its protective armor, and to trust the process of movement once again. This trust fosters a deeper connection to the body, encouraging curiosity rather than judgment, and patience rather than urgency. As hip mobility improves, changes ripple outward through the entire kinetic chain. The knees experience reduced strain, the feet engage more effectively with the ground, and the spine aligns more naturally over the pelvis. Walking becomes smoother, posture more upright, and balance more stable. These improvements reinforce each other, creating a virtuous cycle of movement efficiency and comfort. Everyday activities, from climbing stairs to rising from the floor, become opportunities to experience this renewed coordination, transforming routine tasks into expressions of regained vitality. Perhaps the most profound outcome of restoring hip mobility is the return of freedom. Freedom to move without hesitation, to explore new forms of activity, and to engage fully in the rhythms of daily life. This freedom is not measured solely by range of motion, but by the confidence to inhabit one's body without fear. In this way, the simple act of gently opening the hips becomes a gateway to broader well-being, inviting the body to rediscover its inherent adaptability and resilience, and allowing movement to flow with a sense of ease, grace, and quiet strength. The way we hold ourselves in space is a continuous conversation between gravity, muscle tone, and nervous system awareness, a dialogue that quietly shapes the health of the spine and the ease of movement throughout life. Posture is often misunderstood as a rigid alignment to be forced into place, yet in reality, it is a dynamic state of balance, constantly adjusting to maintain efficiency and comfort. After 50, subtle shifts in muscle strength, joint mobility, and sensory feedback can alter this balance, leading to increased compressive forces on the spine and a gradual accumulation of discomfort.
Ease.
These changes rarely occur overnight. Instead, they unfold slowly, shaped by years of habitual movement patterns, emotional stress, and environmental influences. When posture becomes compromised, certain muscles are placed under persistent strain, while others weaken from disuse. The upper back may round forward, the shoulders drift inward, and the head subtly migrates ahead of the body's center of gravity. This forward shift increases the load on the cervical and lumbar regions, amplifying the effort required to maintain upright stance. Over time, the nervous system interprets this imbalance as instability, responding by increasing muscle tension in an attempt to create support. This protective tension, though well-intentioned, restricts circulation and movement, contributing to fatigue and pain. The body becomes caught in a cycle where poor posture generates tension, and tension reinforces poor posture. Gentle postural realignment movements offer a way to interrupt this cycle. These movements focus not on forcing the body into an idealized position, but on restoring awareness of verticality and balance. By slowly lengthening through the crown of the head, softening the chest, and allowing the shoulders to settle back and down, the spine is invited to rediscover its natural curves. This invitation stimulates proprioceptors, the sensory receptors embedded in muscles and joints that inform the brain about body position. Enhanced proprioceptive input sharpens the nervous system's understanding of alignment, enabling more precise and efficient muscular responses. As proprioception improves, the body becomes better at distributing gravitational forces evenly across the skeletal framework. This reduces localized stress on vulnerable spinal segments, allowing them to rest within their structural limits. Muscles that were previously overworked can relax, while those that had become dormant are gently reactivated. This balanced engagement fosters endurance and resilience, enabling the body to sustain upright posture with minimal effort. Over time, standing and sitting feel less like tasks and more like natural expressions of equilibrium. There is also a subtle yet powerful influence on breathing. Postural alignment affects the mobility of the ribcage and the efficiency of the diaphragm. When the chest collapses forward, breathing becomes shallow, limiting oxygen intake and diminishing the stabilizing role of the diaphragm. Gentle postural corrections create space within the thoracic cavity, allowing the breath to deepen and flow more freely. This improved breathing pattern enhances oxygen delivery to tissues, supports metabolic processes, and activates calming neural pathways. The result is a sense of relaxation that permeates both body and mind, reinforcing the physical benefits of improved alignment. Psychologically, posture carries profound meaning. The way we hold ourselves reflects our emotional state and, in turn, influences it. Slumped posture is often associated with fatigue, low mood, and diminished confidence, while upright alignment is linked to alertness, optimism, and self-assurance. Gentle realignment movements can therefore initiate an internal shift, fostering a sense of openness and vitality. As the body experiences greater ease, the mind follows, releasing habitual patterns of worry and self-protection. This embodied confidence reduces the perception of vulnerability, easing the fear that often accompanies chronic pain and encouraging a more adventurous approach to movement. From a neurological perspective, these changes are mediated by complex feedback loops between sensory input, motor output, and emotional processing centers in the brain. Improved postural awareness enhances cortical representation of the body, refining motor control and coordination. At the same time, reduced muscle tension lowers the baseline activity of pain processing pathways, decreasing overall sensitivity. Over weeks of consistent practice, these neural adaptations become ingrained, transforming posture from a conscious effort into an automatic, effortless state. As alignment improves, everyday activities become more efficient. Walking requires less energy, transitions between sitting and standing feel smoother, and balance becomes more reliable. These functional gains accumulate, contributing to greater independence and reduced risk of falls. The spine, no longer burdened by uneven loads, moves with fluidity and grace, supported by a harmonious interplay of muscles and joints. This harmony extends beyond physical mechanics, fostering a deeper sense of integration between mind and body. Perhaps most importantly, gentle postural realignment nurtures a relationship of respect toward the body. Instead of imposing external ideals of alignment, it encourages listening to internal cues and responding with kindness. This approach honors the body's unique history and current needs, allowing change to unfold organically. In this space of attentive awareness, posture becomes not a static goal, but a living practice, one that evolves with each breath and movement, guiding the individual toward greater comfort, confidence, and freedom in the simple act of standing, walking, and being present in the world. True transformation in the human body does not arise from intensity or sudden effort, but from the quiet power of consistency infused with patience and compassion. After 50, this principle becomes especially important, because the body's adaptive processes unfold more gradually, requiring time, repetition, and trust. Each gentle movement, each mindful breath, sends a signal to the nervous system and tissues, shaping subtle changes that accumulate into meaningful progress. When practiced daily, even for a few minutes, these movements initiate a cascade of physiological adaptations that restore balance, resilience, and comfort, not through force, but through steady encouragement. Consistency allows the nervous system to recalibrate its expectations of safety and movement. Chronic pain often develops when the brain becomes overly vigilant, interpreting ordinary sensations as threats. This heightened sensitivity is reinforced by irregular or sporadic movement, which prevents the nervous system from establishing stable patterns. Gentle, repeated motion provides predictable sensory input, teaching the brain that movement is safe and reliable. Over time, this predictability reduces the need for protective muscle guarding, lowering baseline tension and easing discomfort. The nervous system gradually shifts from a state of constant alertness to one of relaxed readiness, enabling smoother, more coordinated motion. At the cellular level, consistent movement stimulates circulation, delivering oxygen and nutrients essential for tissue repair. Muscles, tendons, and ligaments rely on regular loading to maintain their strength and elasticity. Without this stimulus, they weaken and stiffen, increasing vulnerability to injury. Gentle daily exercise provides the necessary mechanical signals to preserve tissue health, encouraging collagen remodeling and maintaining joint lubrication. These microscopic changes, though imperceptible in the moment, accumulate over weeks and months, restoring the structural integrity that supports pain-free movement. Equally important is the role of consistency in hormonal regulation. Regular, moderate physical activity influences the release of endorphins, serotonin, and dopamine, neurochemicals associated with pain modulation, mood elevation, and motivation. These biochemical shifts create a positive feedback loop, where movement improves emotional well-being, which in turn fosters greater engagement in activity. Stress hormones such as cortisol gradually decrease, reducing systemic inflammation and supporting immune function. This internal environment becomes more conducive to healing, allowing the body to repair itself more efficiently. Compassion shapes the quality of this practice. Many individuals approach exercise with self-criticism, measuring progress against unrealistic standards or past abilities. This mindset generates pressure and disappointment, activating stress responses that undermine healing. Compassionate movement, by contrast, prioritizes listening over pushing, curiosity over judgment. It invites the individual to honor the body's current capacity, recognizing that variability and fluctuation are natural aspects of aging. This gentle acceptance reduces psychological strain, creating a mental landscape where progress can unfold without resistance. The integration of compassion also enhances interoception, the ability to sense internal bodily states. As individuals become more attuned to subtle sensations of tension, ease, and fatigue, they develop a refined awareness that guides movement choices. This awareness prevents overexertion, reducing the risk of flare-ups and setbacks. It encourages timely rest and recovery, ensuring that the body receives the support it needs to adapt. Over time, this dialogue between perception and action fosters a sense of partnership with the body, replacing adversarial attitudes with collaboration. There is a profound emotional dimension to this process. Chronic pain often erodes confidence, instilling fear of movement and uncertainty about the future. Consistent, compassionate practice rebuilds trust, demonstrating through direct experience that the body remains capable of change. Each small improvement becomes a testament to resilience, nurturing hope and self-efficacy. This psychological renewal is as significant as the physical gains, empowering individuals to re-engage with activities they may have abandoned, from simple walks to cherished hobbies. From a neurological standpoint, repetition strengthens neural pathways associated with efficient movement and pain inhibition. The brain reorganizes itself in response to repeated experiences, a phenomenon known as neuroplasticity. Gentle daily practice gradually rewires circuits involved in posture, balance, and coordination, enhancing motor control and reducing reliance on compensatory strategies. Simultaneously, pathways associated with pain perception are modulated, decreasing sensitivity and improving tolerance. This dual adaptation creates a more resilient nervous system, capable of responding flexibly to the demands of daily life. Perhaps the most enduring gift of consistency and compassion is the restoration of agency. In a world that often portrays aging as inevitable decline, these practices affirm the capacity for growth and renewal at every stage of life. They remind individuals that health is not a fixed state, but a dynamic process shaped by daily choices. Through small, intentional actions, one can influence this process, guiding it toward greater comfort, strength, and vitality. In this way, movement becomes a form of self-care, a ritual of respect for the body's enduring intelligence, and a pathway to living with greater presence, freedom, and ease.